Hi, I'm Emma, a board certified psychiatric pharmacist and a professor, and today we're going to be talking about how to treat attention deficit hyperactivity disorder, also known as ADHD. So, some goals that we have for this series of videos, we're going to talk about the diagnosis. So, a little bit of time on symptoms, but then spending time on things like how we treat, what our goals are when we treat, and what those interventions in general look like. Then we'll dig into the actual different interventions that are available for treatment of ADHD, including reviewing some of the differences in things like release, the general mechanism of action of our stimulants and non-stimulants, speaking towards some of the challenges with adverse drug effects and contraindications. So situations where you might need to avoid certain types of medications. And then with the information we'll talk about today, we'll be able to develop a first line plan for treatment, monitoring, safety of treating ADHD. So looking into our diagnostic criteria, so this is our Diagnostic and Statistical Manual, 5th edition text revision. It's a long one, criteria. Big things to think about when it comes to the diagnostic criteria for ADHD is that the symptoms are generally recognized as present prior to the age of 12 and should be in more than one place. So home and work, home and school, etc. Okay. Typically for individuals that are children, the scales that are administered are done by two different individuals, oftentimes not the child themselves. And these symptoms should be present for at least 6 months. Okay. Really, when it comes to diagnosing of mental illness, the other piece that's always really key here, and I think sometimes gets lost, is that dysfunction, right? So it has to significantly impair someone's ability to function. So difficulty at school, difficulty at home, difficulty at work that is not caused by other things, right? So that impairment is what takes, someone's uniqueness or someone's quirkiness or eccentricity and moves it more into that pathological category, right? Now, what do these symptoms actually look like? We have these two categories, right? Inattentive and hyperactive or impulsive. So ADHD is actually in its own umbrella now. It's not ADD versus ADHD, which it used to be. Now it's just subtypes of ADHD. So if someone has 6 or more, unless they are over the age of 17, then it would be 5 or more. On the inattentive side, these symptoms kind of make sense, right? So forgetting activities, really easily distracted, having trouble listening and processing what people are telling you when they speak to you. You might have trouble maintaining organization, completing tasks, maintaining continuous attention, or making just kind of careless errors. Now, the hyperactive impulsive type is more that emotional regulation and ability to self-regulate, things like intrusive thoughts and impulsions, right? So excessive talking, difficulty being patient and waiting your turn, blurting out answers when it's not your turn, acting kind of like you're always on the go. You can't sit still. You have trouble just sitting and being quiet and peaceful. You might be fidgeting or squirming in your seat. You can't sit for long periods of time, running around, all of those kinds of things, right? So very commonly thought of symptoms when people think of ADHD. Absolutely. Now you can have one, you can have both types, you can have the other, right? So you can have a combined type. Now, when we actually look at the kind of lifeline of ADHD, so ADHD should really be treated as a developmental disorder, kind of like autism, for example. So it's something that most experts agree people are born with, right? So that's why those symptoms are present during the developmental period. However, for a lot of individuals, as they age, some people will kind of grow out, for lack of a better word, of their symptoms, sometimes to a pretty significant degree. And sometimes people will have persistent symptoms into adulthood. So as much as, 1 to 2/3 of people might have persistent symptoms. The way the symptoms present tend to change as well, though. So earlier in childhood, we do see a higher level of those impulsivity type symptoms that tend to taper into adolescence and then adulthood. And hyperactivity symptoms also tend to decrease over time. However, inattention, which is what a lot of adults with ADHD still struggle with, tend to persist if they're going to have ADHD that transitions into adulthood. That being said, the other piece that we tend to see happen over time as individuals get older is new comorbidities start to emerge. So things like anxiety. If untreated ADHD, we see higher rates of things like substance use disorder, sometimes personality things. There's correlations with bipolar illness. So it's good to try to recognize and diagnose and manage ADHD in childhood so that we can help reduce some of those comorbidities and have a better diagnostic picture as the individual gets older.